Hello dear colleagues, welcome to Retina.org, a vitreoretinal knowledge sharing platform. In this video, we will talk about the comparative presentation of two cases, one with peripapillary pachychoroid syndrome and the other acquired optic pit secondary to glaucoma. These cases shared by Dr. Giray Ersos, whose Instagram accounts are iRetina, Dr. Giray Ersos and iRetina Review. We are going to present simultaneously these two cases with different diagnoses because their retinal features are very similar. Both patients are male. Case 1 is 20 years old. Case 2 is 73 years old. Both of them have history of steroid use and glaucoma. Case 1 primary angle closure glaucoma and Case 2 primary open angle glaucoma. There's no sign of inflammation in both cases. Their intraocular pressures were under control with topical medications. Cup-disc ratio of Case 1 is 0.8. It is 0.4 in Case 2. Both patients have bilateral signs, but the right eye of Case 1 and the left eye of Case 2 show the similarity well, so we will go on with these eyes. At nasal side of the macula, both patients have larger cysts in outer nuclear layer and small cysts in inner nuclear layer. Case 1 has subretinal fluid adjacent to the optic disc. This is not a pigment epithelial detachment. Both cases have enlarged Halley-Leyers vessels at nasal side. Autofluorescence images don't provide significant information. Slight hyperautofluorescence appears at fovea at both patients. In Case 1, there is a small area of hyperautofluorescence adjacent to the optic discs due to the shadowing effect of the subretinal fluid. There are some peripapillary autofluorescence changes also in Case 2. Fluorescein angiography shows peripapillary atrophy without cystoid macular edema or choroidal neovascularization in both patients. Indocyanine green angiography of Case 1 is unremarkable, except round hypofluorescence area secondary to shadowing of subretinal fluid, but it provides important findings for Case 2. The mid-phase of indocyanine green angiography of Case 2 shows a significant choroidal hyperpermeability between the fovea and optic disc, and punctate hyperfluorescent spots at the upper field. These ICG features are characteristics of pachychoroid diseases, but not a definitive diagnosis yet. Negative staining of the large choroidal vessels in late-phase indocyanine green angiography of Case 2 is another finding indicating choroidal hyperpermeability. Detailed OCT evaluation of optic disc shows an optic pit appearance in Case 1. As you see, Case 2 does not have this appearance. However, different from a congenital optic disc pit, several cavitations in prelaminar tissue appear nearly in all scans of optic disc. So Case 1 was diagnosed as acquired optic disc pit secondary to glaucoma, and Case 2 as peripapillary pachychoroid syndrome. Why do we see cysts in a pachychoroid patient without any sign of chronicity in autofluorescence image? Actually, this condition occurs due to peripapillary atrophy. You can see better in magnified OCT image. There is no photoreceptor or external limiting membrane, and RPE is atrophic adjacent to the optic disc. In classic central serous, the fluid arising from the choroid accumulates under the photoreceptor layer. However, due to the absence of these preventive tissues, the fluid arising from the choroid passes directly to the intraretinal area in these cases. Old age and bilateral involvement are typical in peripapillary pachychoroid syndrome, but can also be present in some patients with acquired pit. Peripapillary atrophy, intraretinal and subretinal fluid can be present, and CME and FA is absent in both conditions. Nasal choroidal thickening and patchy vessels is typical in peripapillary pachychoroid syndrome, but not expected in acquired pit. This is a normal Halley-Leyer vessel. The stroma and the inner choroid are healthy. But these are very large patchy vessels. Here you can see the stromal and inner choroidal attenuation. OCT shows pit, and several prelaminar cavitations in acquired pit. And ICG shows hyperpermeability and punctate hyperfluorescence spots in peripapillary pachychoroid syndrome. Short axial length, choroidal folds, disc leakage in FA can be present in peripapillary pachychoroid syndrome. Differential diagnosis of these conditions with congenital optic pit, cystoid macular edema, AMD, and uveal effusion syndrome is very important to prevent unnecessary medical and surgical interventions.
You can share your interesting and educational cases on our website, Retina.org. Don't forget to click the like button and follow our channel to be informed about our new posts.